Welcome to the stream of knowledge.
Do you know? Our brain controls our movements, stores our memories, and is the source of our thoughts, emotions, and language. Brain also controls many functions of the body, like breathing and digestion. To work properly, your brain needs oxygen. Your arteries deliver oxygen-rich blood to all parts of your brain. If something happens to block the flow of blood, brain cells start to die within minutes, because they can't get oxygen. This happens in stroke. Yes. Today, you are going to know about stroke, its symptoms, and its treatment. A stroke, sometimes called a brain attack. It occurs when something blocks blood supply to part of the brain, or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. One more important point you need to know about stroke is, there are two major types of stroke: ischemic stroke and hemorrhagic stroke. You also have heard about transient ischemic attack or TIA. A transient ischemic attack or TIA is sometimes called a mini stroke. It is different from the major types of stroke, because blood flow to the brain is blocked for only a short time, usually no more than 5 minutes. TIAs are sometimes known as warning strokes. It is important to know that a TIA is a warning sign of a future stroke. Now the question is, what is ischemic and hemorrhagic stroke? Most strokes are ischemic strokes. An ischemic stroke occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockages by building up in the blood vessels. A hemorrhagic stroke happens when an artery in the brain leaks blood or ruptures, breaks open. The leaked blood puts too much pressure on brain cells, which damages them. Now the question is, what are the symptoms of stroke? Signs and symptoms of stroke include: Number 1. Trouble speaking and understanding what others are saying. You may experience confusion, slur words, or have difficulty understanding speech. Number 2. Paralysis or numbness of the face, arm or leg. You may develop sudden numbness, weakness, or paralysis in the face, arm or leg. This often affects just one side of the body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Number 3. Problems seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes. Or you may see double. Number 4. Headache. A sudden, severe headache, which may be accompanied by vomiting, dizziness, or altered consciousness, may indicate that you're having a stroke. Number 5. Trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. Number 6. Confusion, disorientation, or lack of responsiveness. Number 7. Sudden behavioral changes, especially increased agitation. We will discuss treatment of stroke in our next lecture.
Thank you for watching. Do subscribe, like, comment, and share.